Medicare doesn't make any sense, so it's really important to understand both parts of Medicare. We've talked about in a previous video about Part A. We're going to look at Part B right now so you have a full understanding of both parts of Medicare. Part B covers the outpatient medical services. The Part B covers almost everything that will happen outside of a hospital setting. So it covers your doctor visits, which would include both your primary and your specialist visits. It would also cover your preventative care. It would cover outpatient surgeries, and it would cover things like chemotherapy and very expensive infusions and vaccines. It would also cover durable medical equipment and even ambulance rides. Part B does have a deductible to it. So the deductible for Part B is very, very different than it is with the Part A. Let's talk about that right now. The Part B has a deductible in 2021, which is only $203. This deductible is actually a calendar year deductible from January 1st through December 31st versus a benefit period deductible, which we talked about earlier, of 60 days like that of Part A. Please watch the Part A video to get a better understanding of both parts of Medicare. See, once this deductible has been satisfied, the good news is this: the individual has met Medicare's Part B deductible for that entire calendar year. So once someone has paid out $203 for that calendar year, they have met the deductible. However, there is a problem. The individual is still responsible for a 20% coinsurance, which can be a big, big problem for someone that just has Medicare Part A and Part B, because Medicare will only cover 80% of all medical expenses. So that would leave the individual responsible for that 20% every single calendar year. So unfortunately, Medicare Part B does not have a maximum out-of-pocket cap like most private insurance plans that we're used to. That other 20% would be that individual's responsibility for that entire calendar year. So in order to make this as simple as 1, 2, 3, let's talk about how that 20% works with Medicare. So let's say that someone has a $100,000 procedure that they have to have done, and they only have Medicare Part A and Medicare Part B. They're able to go anywhere they want to with their Medicare card, but unfortunately, here's what would happen. Medicare would pay 80% of that $100,000 medical bill, and that would leave somebody with the responsibility of, you guessed it, that other 20%, which would be $20,000. So with Medicare A and B, unfortunately, that is not enough. That could financially ruin anybody that just has Medicare Part A and Part B. That's why it's so important to continue to watch some of our future videos to be able to go ahead and see how to go ahead and take care of that financial responsibility so that you do not have to worry about it.